Around and during my menstrual cycle, I would basically go through tremendous pain, and the pain was so severe that it literally took me to the floor.
I was at a family reunion, I was playing with the children, we were on a trampoline jumping up and down, and every time I jumped down, a little bit of pee kept coming out. So I went to my doctor and they said it's stress incontinence and I have a fibroid.
I had very heavy flow periods. Ended up going to my doctor, getting a vaginal ultrasound and determining that I had fibroids.
When I had uterine fibroids, they were a problem for at least 10 or 15 years that got progressively worse. And my mother had to have a hysterectomy because of them. I didn't know what my options were, but I suffered from them. The problems became progressively worse, having to get up and urinate, use the bathroom in the middle of the night. My stomach was protruding. It looked like I was 4 to 6 months pregnant as they got progressively worse. And it got to the point that I was reminded daily that I had them.
After 2 years of very heavy flow and very bad discomfort, I just had to do something about it.
Patients are concerned with downtime. They might have a family that they're trying to raise. They have a career, they have work that they can't take a month off of work or 2 months off of work to recuperate.
Well, after numerous months of this occurring, I basically talked to my gynecologist and said, I need to do something about this. So we spoke, and he recommended a myomectomy procedure because that was the thing that was available for me, and based on my lifestyle, my age, my symptoms, that's what he suggested. So we went through that procedure, and I was basically out of work for about 10 to 12 days, which was really devastating to me considering the type of work that I was doing and my life commitments at the time.
I consulted with about 3 doctors and 3 different procedures. Embolization, birth control pills, and hysterectomy.
Well, for the fibroid treatment, they were recommending either a hysterectomy, which I thought that was overkill. And personally, I'm really scared of surgery. I don't want knives. I don't want to go under anesthesia if it's not necessary. And so when I researched and heard there was a way to just have focused ultrasound, which is totally safe and totally non-invasive, I definitely wanted that.
I have patients who have significant anxiety about having fibroids, whether it be their heavy flow, whether they're going to have a problem out in public and everybody is going to realize what's going on, or whether they're just significantly fatigued from all of this, and clearly that fatigue again affects your life in so many significant ways. Your job, if you don't have the energy to get through your day, it can impact every part of your life, and I think patients feel that way.
I did research online to look for an alternative to having to have a hysterectomy, and found the Curawave procedure, which I pursued and am really glad I did.
It's really easy, it's really cool. Your stomach is kind of in a salad bowl, and you just lay there and relax. That's it, that's all you have to do.
It was the easiest one. There was no surgery, there was no downtime, no pain. It was the easiest thing.
After hearing about the Curawave technology with MR-guided focused ultrasound, I was excited for the fact that women are going to be able to experience immediate relief and not have any downtime and not have any surgical incisions.
I met Dr. LeBlanc during the first consultation, and when she told me about the procedure and how it worked and what would take place, and her enthusiasm, even from the beginning, was inspiring. She walked me through every phase of the procedure, and it went very, very well. I felt that we were a team through the entire procedure.
Well, I'm really glad I had Curawave because guess what? I had a baby. I wasn't planning on having a baby at the time, but if I had a hysterectomy, I wouldn't have my little Gabriel. Life is wonderful, life is good. I thank God every day.
As a result of having the procedure, I have a normal life. I started a new plant brokerage business about 3 years ago, and I ship plants throughout the world. I have several goats. I milk a goat every morning, have chickens and turkeys, and have completely changed my life. And I believe that the Curawave procedure played a role in that.
It totally changed my life. I went from having terrible symptoms on a daily basis to living my life perfectly, no anemia, so full of energy, full of health. Wonderful, really wonderful.
I'm really excited about being part of the MR-guided focused ultrasound team, whereby we utilize the Curawave procedure to treat women with uterine fibroids. It's a groundbreaking technology that allows women to go back to work the next day. There's literally no downtime, and more importantly, there's no incision. So it's groundbreaking technology, and to be able to go in and out of a treatment facility without an incision and go back to work the next day is unheard of in our day and age. So I'm very excited about that.
The FDA has approved the MR-guided focused ultrasound procedure to be performed here in the United States. There are places in California like Stanford that perform the procedure, in the middle of the country at the Mayo Clinic, and on the East Coast at Duke as well. So we're in very good company.